Mr. Speaker, sir, let me now address questions as to whether MOH should have informed the public earlier. In 2016, MOH had to decide whether to inform the affected persons and whether to make a public announcement about the incident. These were not straightforward decisions. On the one hand, there is the need to be transparent. On the other hand, we need to consider the impact of an announcement on the affected persons with HIV. Would it serve their interests or would it harm them instead? I discussed this with my medical colleagues in MOH. They emphasized the need to pay particular attention to the concerns and needs of HIV patients. Excuse me. A person's HIV status is a deeply emotional and personal matter. Some patients will experience high anxiety and distress from a disclosure or announcement. Some will feel compelled to reveal their HIV status to family members or friends. Relationships can be disrupted, lives can be changed. We had to exercise care and judgment in making our decision, and the well-being of the affected persons weighed heavily in our considerations. One key factor was that there was then still no evidence that the confidential information had been disseminated to the public. Brochet had sent the information to government authorities. The police search was extensive, and all relevant material found had been seized or deleted. While there could be no guarantee, MOH had good reason to believe that information had been secured and the risk of future exposure significantly mitigated. Ultimately, it was a judgment call to be made based on the information we had and the considerations for and against an announcement, and the assessed risk of future public exposure of the information. MOH judged that on balance, an announcement then would not serve the interest of the affected individuals when weighed against the inevitable anxiety and distress they would experience.